Hello everyone, welcome back to Medical Study 19. Today we will discuss a very important urological condition, nephrolithiasis, commonly known as kidney stones. This topic is clinically significant because it is one of the most common urinary tract problem worldwide. Nephrolithiasis. Nephrolithiasis refers to the presence of renal calculi, which are solid concretions formed from minerals and organic substances within the kidneys. Now we can see uh, that the male is to female ratio is 3:1. It means it is more common in male, uh, and the peak incidence is seen in young and middle-aged adults. Hot climates and dehydration increases the prevalence. So countries like USA, India, Pakistan, Middle Eastern regions saw higher cases. Now, types of stones. There are multiple types of stones, but calcium calcium stone, also known as calcium oxalate, is by far the most common. Another type is struvate stone, are due to infection. Uric acid stone and cystine stone, which occurs due to genetical disorder. And we'll study about detail. Calcium stone, also known as calcium kidney stone. It is about in 80% of cases, it is the most incidence, and the risk factor responsible for causing this type of stone is calcium or vitamin D dietary supplement, foods which are very high in oxalates, fruits such as avocados, dates, grapefruit, kiwi, orange, raspberries, Spanish, and tomato sauce. Struvate stone, in about 10% of cases, it is found and composed of magnesium, ammonium, and phosphate. The risk factors includes urinary tract infections, Proteus mirabilis, Klebsiella pneumonia, Enterobacter, and Pseudomonas aeruginosa. Uric acid stone, about 9% of cases. The risk factor is mainly due to diarrhea and gout arthritis, due to and other intake of higher amount of proteins also cause this type of stone. Cystine stone. It is a rare type and is also known as cystinuria. As we already have studied about their incidence and types, now the main causes of calcium and risk factor we have already studied. Some other causes includes idiopathic hyperuricemia, hypocalcemia, hypercalcaria, hyperuricosuria, primary hyperthyroidism, primary renal tubules, and acidosis also responsible for calcium stones. This type of stone is caused by the supersaturation of calcium ions in the urine and alkaline pH of the urine. The gross structure we see is small, smooth, counter or irregular jagged mass of spicules, as we have already seen in the previous figure. Struvate stones, about 10 to 15% of incidence, mainly caused by infectious organism, and the pathogenesis is alkaline urinary pH due to production of ammonia from urea. The gross structure we see in this type of stone is large solitary branching structure formed due to progressive acceleration of salts. A uric acid stone, about 6% of incidence we can found, mainly due to gout, dehydration, idiopathic and malignant tumors. It is caused due to acidic urine and decreased solubility of uric acid. The gross structure we see in this type of stone are smooth yellow to brownish color, and they are hard and multiple. Cystine stones. It is a rare type of stone and occur. It is in hereditary, caused by the cystine precipitates in acidic urine. The gross structure we see in this type of stone are the stones are small, smooth, yellow, and round. Now, clinical features. The hallmark symptom of stone is kidney stone is severe flank pain, often described as the worst pain a patient has ever felt. It radiates to the groin, accompanied by hematuria and sometimes nausea and infection. The some other pain, other clinical features include the pain fluctuates. Uh, it causes burning sensation while urinating, pink, red, or brown urine. The urine is cloudy with a foul smell. There is will be severe nausea and vomiting, and it will also be able to cause fever and chills if any infection is present. Risk factor. The risk factor includes family or personal history. If someone in your family has had kidney stones, you are more prone to develop stone. Dehydration. Not drinking enough water each day can increase your risk of kidney stone, and certain diet, eating a diets that are high in protein, sodium, and sugar may increase your risk of some types of kidney stones. Digestive disease and surgery, gastric bypass surgery, inflammatory bowel disease (IBD), or chronic diarrhea can cause changes in the digestive process that affects your absorption of calcium and water, increasing the amount of stone forming substance in your urine. Certain supplements and medications, such as vitamin C, dietary supplements, laxative, calcium-based antacid, and certain medication used to treat migraines or depression can increase your risk of kidney stone. Diagnosis. Diagnosis is begins with a urine analysis and blood test. Imaging is crucial. CT is good standard while ultrasound is safe in pregnancy. Now, treatment. Uh, Small stones often pass spontaneously with hydration and pain control. Larger stones may need interventions such as lithotripsy or surgical removal, ure- ureteroscopy, PCNL, also known as uh, percutaneous lithotomy, ESWL here, also known as extracorporeal shock wave lithotropy. And the main is um, parathyroid gland surgery. Some calcium phosphate stones are caused by overactive parathyroid glands, which are located in four corners of your thyroid gland. So when these glands produces too much parathyroid hormone, your calcium level can become too high and kidney stone may form as a result. So preventive lifestyle medications are very important to avoid reoccurrence. And in conclusion, nephrolithiasis is common but preventable condition. Early recognition, proper management, and lifestyle changes are key to reducing reoccurrence. Thank you so much for your watching. If you found this lecture helpful, please like, share, and subscribe to Medical Study 19 for more medical topic explained in detail.